Brought to you by IBM. Let's build a smarter planet. Visit ibm.com/ZA.
The burden of disease in this country is very high. We're one of the highest in the world. So there are no easy answers, but government by itself cannot fix the problems. In South Africa and in most emerging markets in the world, if you go into a public hospital and you're treated, the record for what happened to you exists only in that hospital. If you then have the same symptoms and a month later you go to a different hospital, they'll treat you from scratch. And in fact, they will run all the tests required to determine the treatment protocol. And it's those tests that cost all the money. Whereas if they had access to your patient records, they could probably cut the cost and the time it takes to treat you in half.
There's a tremendous amount of people living in rural areas challenged by the fact that they don't have access to hospitals that are just around the corner. They don't have a record of their birth, their vaccinations if they had any, etc. So there's a lot of lack of information. But if you use technology smartly and you can, using the iris and the eye and scan people and help diagnose conditions and situations and understand the symptoms that people have through fingerprinting, through various different technologies. There's a lot of work that's gone into that as well.
And that's where smarter healthcare comes in. So how do you take the concept of, let's say, telemedicine, where you deploy into your rural communities medical technicians who maybe have 2 or 3 years of training, very competent, but unable to diagnose especially complex conditions, with the right kind of technology in the field, and then somebody sitting centrally who can help with the diagnosis that makes them effective. We're not able today to take medicine to the people. We're trying to bring the people to medicine, and that's not going to work in Africa.